Participate today will have a chance to review this valuable information at a later time. All webinar participants will be muted, and you can submit questions throughout the webinar in the Q&A box, so hopefully you can locate that. And you can do that anonymously if you like. We encourage you to submit general questions about migraines. So if you have questions about your personal treatment, for instance, we would just ask that you please address those with your personal physician. And so finally, to enhance your viewing experience, you may want to slide your little mouse up to the top and you can go to viewing options. And if you click on that, you'll find something that says side by side, and then you'll be able to see all our smiling pretty faces on one side, and then also have the presentation right there with you as well. So before we get started, let me introduce you to our facilitators who will guide you through our migraine webinar. First, we have Kim Gill, who you guys know as your health coach in the Metro Nashville Healthcare Centers. Next, we have John Z. Holt, who is your staff wellness coordinator at Metro Nashville Public Schools. Also, we're pleased to have Dr. Martha Shepard, who is a family medicine physician and medical director for the Metro Nashville Healthcare Centers. She will lead our Q&A discussion at the end of this presentation. And finally, we are very honored to have as our special guest today, Dr. Dane Chetkovich. Dr. Chetkovich is a Margaret and John Warner Professor and Chair of Neurology at Vanderbilt University Medical Center. So please take advantage of this wonderful opportunity to get your questions answered today about migraines. So with that introduction, let me hand it over to Ms. John Z. Holt, who will lead us in a short breathing exercise. John Z.
Thanks, Phil, and welcome everyone. Thank you so much for taking time out of your day to join us. I know a lot of you have had a long day today, whether you've been working in your office, teaching remotely, or maybe teaching in the classroom today. So we're gonna do a quick 3-minute mindful breathing activity together just to help us center ourselves and get ready to learn together today.
Mindful breathing. Close your eyes and rest your hands on your knees. Bring your attention to the touch of your body on your seat. Feel the weight of your body on your chair or cushion. Make sure that your back is straight and that you're comfortable. Take a few deep breaths. While you're breathing deeply, relax your shoulders, your stomach muscles, the muscles in your face, your hands, and your legs. Let go of all the tightness in your body. Now bring your attention back to your breath. Notice what it feels like as it enters through your nose, goes down through your throat, filling your lungs, and back out through your nose. Notice your stomach and chest rise and fall each time you breathe in and each time you breathe out. And just allow your breathing to be natural and relaxed. Now bring your attention to the feeling of your breath in your nose. Feel your breath as it comes in and goes out. Just focus on this sensation, paying attention to each time you breathe in and each time you breathe out. As you inhale, maybe your breath feels cool. And as you exhale, maybe it feels a little warmer. When your mind wanders, or if you become distracted, just notice what's going on in your head, and then gently bring your attention back to your breath, going in and out. Focus on the feeling of your breath and allow thoughts and feelings to come and go in the background. Now gently bring your attention back to the touch of your body on your seat and open your eyes.
Thanks, everyone.
Wow, that was great. I think now I need a cot and a good down pillow or something like that. No, I'm kidding. I'll stay awake. But anyway, that was fantastic. I do feel a lot more relaxed and calm. So now I want to turn it over to Kim Gill, and Kim's going to take us through Migraine Basics.
Thank you, Phil. Hi, Dr. Chetkovich.
Hello, how are you?
Well, we are so glad that you could join us this afternoon on this discussion about migraines. Thank you.
Sure thing.
Well, we just learned you're a neurologist at Vanderbilt. What else would you like to share with our audience about yourself?
Well, let's see. I grew up in Texas. I always wear cowboy boots because my wife is a lot taller than I am. Can't tell because I'm on the Zoom. But I spent some time in California, in San Francisco, where I did my residency in neurology. And then I was at Northwestern in Chicago for 15 years before coming to Nashville 3 years ago. And I'm the chair of neurology at Vanderbilt. And I also see patients, and I have a specialty in migraine.
Wonderful. Well, thanks for that information. You've been to some fun cities, and next time we will have a shoe contest, now that I know that you wear cowboy boots.
All the time.
Perfect. Well, thanks. Well, let's get started, shall we?
Sure.
All right. Well, as Phil mentioned, we're going to start with the basics of migraines. Probably most of us on this webinar have had experienced a headache before, but we may not really know the difference between a headache and a migraine. Can you explain what is a migraine?
So a migraine is a type of headache that is special in that it involves parts of the brain and the blood vessels and the nerves of the head that gives rise to unique symptoms that are different than tension headaches, for example, or headaches that are caused by other things. And they're, on the slide, as you can see, it's often one side of the head that's involved. It can be either side of the head. It doesn't always have to be one side of the head. They're episodes, so they tend to come on sometimes without provocation. Some people have triggers. You're going to talk about that a little bit later. And then they're associated with these changes in the brain that lead to the sensation of nausea or dizziness. Sometimes patients vomit, and then they often have irritability, mind fog, and sensitivity to light and noises. So migraines are what we would classically call sick headaches, where you actually feel sick, not just from the pain, but from these other symptoms as well.
That's really helpful to address it as a sick headache. That is much different from a normal headache, and sounds pretty intense. Next slide. We learned in this webinar that migraines commonly occur between the ages of 18 to 59. But do many people suffer from migraines?
It's very common. It is the prevalence, meaning how many people in the population have it, varies from between 10 to 25%. So almost 1 in 4 people have it. Oh, wow. And it tends to run in families. So, oftentimes we'll hear from the patient that their mother or their aunt or their grandparent has it, or their kids have it, or their siblings have it. So it's really common to run in families.
1 in 4. Ooh. With them being pretty common, how can a migraine impact your daily life if you're suffering from migraines?
Well, you can imagine. I mean, if you feel sick, it's hard to do other things. You know, and if you vomit with your headache, obviously you can't work, you can't take care of your kids. It makes it, you know, and the cloudy thinking makes it hard to concentrate and get the things done that we need to get done.
Mhm. Yes, all right. Next slide, please. And so we've also learned that migraines have several phases. Can you explain what happens when a migraine occurs in these phases?
Yeah, sure. So the actual migraine attack itself is when the head pain is present and when you feel the sickest. And that can last from hours to days in some people. But it turns out that many people notice that before the head pain comes on, they begin to have symptoms. And these symptoms can include things like sparkles in the vision, blind spots in the vision. Some people get tingly in their fingertips and in their lips. And then the headache comes on after that. So that's the pre-migraine. Then you've got the migraine. And then after the headache is gone, many people report that they feel hungover, that they feel as if they can't think as well, they can't communicate as well, and they may just not feel good. And that's the post-migraine or the migraine hangover.
And it says on this slide here that that can last up to a full 7 days.
It sure can, and some people have you know, multiple migraines where it never relents, so they have daily headaches.
Do they experience like all the phases as well, or?
Everyone is different. Some people have 1 or 2 migraines per year. Other people have very frequent migraines, once a week, twice a week, and there are some patients who have continuous headache all of the time, and it's punctuated by higher intensity, higher severity, but they say that they always have pain in their head. So it varies. For sure, the most typical is someone that has 1 or 2 a year.
Right. Well, gosh, we're just talking about how it impacts your life. To be living with migraine pain every day has to impact every aspect of your life. When I was reading during covering the material, the pre-migraine, their symptoms made me think about how I feel after a full day of Zoom meetings. We were talking about that.
That's right. That's right. You're just out of sorts.
Right. So it sounds like everyone has their own unique symptoms and impact. Some might experience more symptoms than others. How are migraines properly diagnosed then?
Well, it's really a clinical diagnosis. There's no test that we can run to determine whether a headache is a migraine or not. So we use all the features that I talked about. Is there an aura or a warning before the headache starts? Is the headache on one side? Typically, migraines are throbbing pain. They can be dull, aching pain. Sometimes they're sharp. But the real question is whether or not the patient feels sick. And that's really the hallmark of a migraine. So do they have the dizziness? Do they have the nausea? Do they feel brain fog? That's really how a doctor will come to the conclusion that a headache is a migraine and not a different kind of headache.
So knowing your signs and symptoms are really important.
Correct.
Great. All right. I would like to point out to the audience that you have access to this doctor discussion guide. You were granted that access when you registered for the program. And this is a useful resource for you to collect your information and bring this with you to your provider's visit. It covers pertinent information such as the number of migraine episodes, the number of migraine affected days, what medications have you tried to manage your symptoms, including over-the-counter remedies, and importantly, what does your life look like living with migraines? I encourage you to print it out and complete it to help facilitate a conversation with about your migraine experience. So to recap, a migraine is more than a headache. It's a sick headache that we learned. It is something that people have to manage in their everyday lives, and a provider can help diagnose a migraine. Thank you for explaining the migraine basics, Dr. Chetkovich. Is there anything else you would like to cover before we move on to migraine triggers?
Well, I assume we're going to talk about treatments later in the program, so we'll wait for that.
Okay, great. Thank you so much.
Sure.
Bill?
Yeah, thanks, Kim. That was very good. And let me remind everyone who's participating, please think of your questions. I think we're going to have plenty of time to answer, all the ones that you have. And I sure want to make sure that we take advantage of having just such a wonderful resource in Dr. Chetkovich here today. So, be thinking about your questions, be thinking about things that you might want to know, and please post those in the Q&A as we go forward. So our next section, we're going to cover migraine triggers. And so I'm going to turn it over to Johnsy, and she's going to take us through that session.
Awesome. Well, so we talked about the basics of migraine, and now we're going to touch on some migraine triggers. So in session 2, it's a little bit of a recap. We learned that migraines may be triggered by several different factors, and those factors can broadly be in 3 of the categories shown here. So they could be dietary, lifestyle, or environmental factors that are triggering a migraine. Dr. Chetkovich, question for you. Can you share with us some of the things that can trigger a migraine?
Well, the migraine triggers are pretty much different in everyone, and if you suffer from migraines, you'll figure out what your triggers are. And some people get migraines after they drink red wine, for example, or after they eat a strong cheese. Some people get migraines from strawberries or shellfish. And it's not really clear why these triggers trigger different people in different ways. But some of the things that commonly, red wine is one of the most common triggers, and alcohol in general can be a trigger. Caffeine can be a trigger in some people. And if you're a daily caffeine user, stopping caffeine can trigger migraines. Lifestyle things, poor sleep hygiene. So if you're not getting good sleep, if you're under a lot of stress, emotional stress, work stress, financial stress, all of those things can drive a person who's a migrainer to get a more severe or more frequent attacks of migraine. One of the other things is not eating regular meals. So if you skip breakfast and then you miss lunch, that can provoke migraines. So there are a lot of things. And then environmental, sometimes people have, bright lights can trigger migraine, or changes in the barometric pressure when the weather changes. In some people that triggers a migraine. And it's not really clear what the link is, but it's really clear that some people, that's what happens to them.
Well, it sounds like migraines are incredibly unique to each individual and can be really complex. So I guess this next question that I have for you is a little bit broad, but do you have any tips that you could share with us for managing triggers if someone's identified their triggers and needs a little bit of guidance managing those?
Well, one of the things that we do if you've got migraines and you come into the clinic is we ask you to keep a headache diary. And we ask you to pay attention to what's happening in the day or hours before the development of a headache. Did you skip breakfast that day or the day before? And that kind of question. So you keep a diary about when you have a headache and what you're doing with respect to what you're eating, what you're drinking, your sleep, your stress. And then that allows you and the doctor to develop some clues about what might be the trigger for you. People with frequent migraines can figure it out.
Those are some great tips. And that actually brings us to our next topic that we talked about in session 2. So you also learned that setting goals, if you participate in session 2, setting goals may help those with migraines take action on a management plan. So like Dr. Chetkovich mentioned, a diary. So that's actually one of the tools that you have available to you as part of the Working with Migraines program. You have that tracking diary as well as a migraine management goal checklist, which you can see pictured here on the screen. If you need to access these documents, maybe you haven't downloaded them yet, no problem. You can just go right back to the website where you accessed your sessions, and they are listed under the session, so you can easily find those there. So of course, we recommend that you talk to your doctor, your particular healthcare provider, to determine management plans that are helpful to you. You can use these tools to help you establish your goals. Dr. Chetkovich, do you have any tips for our listeners on how to talk about their migraine with their primary care provider?
Well, I think being informed is really important, because some people that 75% of people don't get headaches, and if your provider has never had a headache, and in particular if they've never had a migraine, they might not really know what you're suffering, and they might not understand the disease well. And so you've got to educate yourself so that you can communicate with your provider. I think I have migraines, or share with them the clues that you've learned. Are there triggers? Do you feel sick? Or do you have the nausea? Do you vomit? Sharing those things will help them make the correct diagnosis so that they can help you manage your headaches appropriately. So, that's what I would suggest.
Great. Those are great tips. Thank you so much.
All right. Yeah, that was fantastic. I've been learning a lot about migraines, and it was very interesting. And Dr. Chetkovich, if you could maybe opine on this before I turn it over to Dr. Shepard, but you mentioned that a lot of times we'll go to providers, medical providers that have never had a migraine. What's your sense of how, just in general, our primary care docs are able to appropriately diagnose, and then if they need to make a handoff to a specialist, can do that effectively? Or like you said, do we really need to be prepared if that's the method that we go to get our questions answered about migraines?
Yeah, sure. Well, most primary care providers, doctors and nurse practitioners and physician's assistants know what migraines are, and they do a pretty good job great job managing them when they're straightforward. But migraines can be more difficult to treat. Some people have migraines that are really hard to treat. The treatments, the over-the-counter treatments, might not work so well, and so in those cases, when the headaches are persistent and they are impacting your daily life, and you've tried some of the first line treatments, there are some prescription medicines that can help. That's the point in time where a specialist can be helpful. And all neurologists are equipped to treat migraine, and there are even people who are headache specialists who will treat the really difficult ones. And there are really difficult migraines out there.
Very good. Well, that's fantastic. So I think we've had a really good review of basics and triggers. And so now I'm just going to turn it over to Dr. Shepard. I see that this is fantastic. There's several questions in the Q&A. And so let's move to that section, and we'll start addressing some of the participant questions. So Dr. Shepard.
Good evening, everyone. And thank you, Johnsy and Kim and Dr. Chetkovich, for reviewing some of the material that have been part of the migraine program so far. We do have some great questions coming in on the chat, and I encourage you, this is your opportunity. So you can post them anonymously, or you can post them with your name, and we will run through these. I'm just going to start at the top. The first question is interesting. It says, my migraines are the worst when I have the ceiling fan and AC on at the same time. What's going on? Great.
Well, that's a trigger. And it turns out that when you have a migraine, your sensations are not working properly. In other words, your balance organs that tell you when you're spinning around normally, the central processing inside your brain is distorted so that your brain thinks that when you've got a migraine, you feel dizzy, that you're spinning around. And the same sort of thing is true of skin sensation. And so the skin sensation during a migraine can be altered, where things that are cold feel very cold, things that are hot feel very hot. And that abnormal signaling from the sensory organs can basically drive the migraine and make things feel worse. So that's kind of what a trigger is when it's weather or it's cold temperatures. It's basically what normally should just be feeling like wind blowing on your face is actually signaling the brain that more than just wind is blowing on your face. It's connected to, you know, dizziness and nausea and pain. And so that's probably what's going on here.
That's really interesting. I happen to be one of those primary care physicians who also suffers from migraine headaches and have learned so much through the years. And in helping my patients with the same thing, have heard many triggers, and there's very common ones, and then there's unique ones. And I had not heard that one, but your answer makes a lot of sense. So I love these questions, guys. Keep the questions coming. The next one, I think we have addressed. The question was, when is it appropriate to see a specialist? And I think you kind of went through that criteria, specialist versus when to just handle the migraine through primary care. You know, one thing that I think would be important to talk about is often as a primary care provider, patients would come in and be concerned that they needed to have imaging, a CAT scan or an MRI because of these headaches. Would you just talk briefly about when imaging would be indicated?
Yeah, sure. So as a neurologist, when we have a patient that has really clear-cut migraine, we don't typically do imaging. And that's when the case is real clear. Unilateral, one-sided headache, throbbing, nausea, you know, a warning before with sparkling lights. If it's a really clear case of migraine, we don't typically image the patient. When we do imaging is when a patient has migraines and they develop symptoms of that are concerning. So if you develop weakness or numbness on one side of the body or the other, during a migraine, that's what we would call a complicated migraine. And that is a little bit more of a warning sign for us. So we typically, if there are neurological signs that include weakness or double vision or inability to speak, we would image someone. We would also image someone if their physical exam was abnormal. So if someone came to me and I examined them and I found that their reflexes were abnormal on one side of the body or in the legs only, I would consider imaging for that. There are certain things, there are other kinds of headaches that are more concerning. If it's the first headache in your life and it's the worst headache in your life, we would typically image someone like that. If you're 50 years old and you've got your first headache of your life, that's a concern for a neurologist. We would probably want to evaluate that with imaging. But you know, for migraine, typically it's not needed to get imaging.
That's great advice. Here's a big one that I know affects a lot of people. The question is, what is the relationship of migraine with hormones, particularly in females?
Yeah, well, that's a fantastic question, because some people's migraines are very clearly associated with hormones. And for those folks, they might have migraines on a specific day of their menstrual cycle, or right before their menstrual cycle, or during their menstrual cycle, or after their menstrual cycle. And it's like clockwork. It happens every month. And for those cases, it's really clear that hormones are playing a role. And it's also clear that hormones play a role in boys as well, because a lot of times boys will start to get headaches around the time of puberty, or they might have headaches young, and then when they go through puberty, they go away, the migraines go away, and they reemerge, after college or at other times. Pregnancy can impact headaches. They can make migraines worse, and for some lucky people, the migraines go away completely during pregnancy. So these hormones definitely impact headaches, and they do so differently in different people. But if you notice a hormonal pattern for yourself, that's something to consider talking with your doctor about, because there are some specific treatments that can be used in patients who have menstrual migraine or menstrually related migraine.
Yeah, and in talking about triggers, I know in my own experience and with patients, at different phases of life, hormones are going to be a different issue, but I know for a lot of women who start taking birth control pills.
Absolutely.
That will be the onset.
That's true. Taking birth control pills often will provoke headaches. And another issue is that women with migraine who take birth control pills have an increased risk of stroke. And so as a neurologist, if a patient comes to me and they've got migraines, I always ask about birth control pills, because birth control pills by themselves increase the risk of clotting and stroke, and the combination of migraine and birth control pills it further increases the risk. And if you smoke on top of that, there's about a six to eightfold increased risk of stroke. So, this is always something that we discuss with our patients. And, one of the, I guess, good things about menopause is that many patients with migraine, when they go through menopause, the headaches get much better. So that's, one other aspect of hormonal relationship to migraine.
Mm-hmm. We could almost have a webinar on its own about this and different strategies for dealing with that. I guess if we have some time at the end, we might go back to that one.
Sure.
But I want to be sure we get to, we've got many questions coming in. So,
all right.
Next question is, what is going on neurologically that causes blind spots and fuzzy thinking?
Well, that's another great question. And it's in line with the earlier question about why wind blowing on the face might make things worse. And that is that during a migraine, there are changes in the chemical and electrical signaling inside the brain. So there are actual electrical changes that take place during migraine that temporarily put parts of the brain to sleep. And it migrates throughout the brain. It's this phenomenon that's called spreading depression. Not depression like sadness and depressed, the medical depression. It's the electrical activity of the brain that gets temporarily suppressed. And when it moves over the part of the brain that's responsible for vision, it causes blurry vision, darkened spots in the vision, and sometimes these sparkling lights that we often hear about from patients with migraine. So it's basically the migraine itself is impacting the brain in a way that's disconnecting parts of it from the whole brain, so you can't function normally.
Yeah, it can be disorienting. And I would say, there's that prodrome where you can kind of have that before you get the headache. And then there's also the time after the migraine has resolved that you can even still have that fuzzy thinking feeling. And that makes sense that it's just an area of the brain that's got depressed activity at that point.
Exactly.
The next question is from John. We have talked about migraine and stroke a little. He's asking, is there a connection between migraines and strokes? We talked more specifically in relation to hormones, but in general, is there a connection between migraines and strokes?
Yes, there is. And basically people who have migraine have an increased risk of stroke. Because what happens during a migraine is that I've talked to you about what happens inside the brain. Well, what's happening with the blood vessels is that the blood vessels are abnormally constricting and dilating. So that abnormal activity can lead to a propensity to have a blood clot. So for most people who are young, the risk of stroke is very, very low. But if you pile on top of a person use of oral contraceptives, so estrogens can increase the risk of clots. Smoking increases the risk of clots. High blood pressure, diabetes, these other factors, the risk of stroke goes up, and we know that migraine increases the risk of stroke. So it's a confounder. It doesn't cause stroke per se, but remember when I talked about complicated migraine, when part of the body goes numb or weak, that's what we see in a stroke as well. And it turns out that people with those complicated migraines are at the highest risk of stroke, because what's happening during a complicated migraine is the blood flow is being altered to those parts of the brain that are shut down.
Right. Next question is, are migraine headaches hereditary? Is it common to have children who have migraines if their parents and grandparents have them?
It is. It's not the inheritance pattern and the exact genes that lead to migraine aren't known for the vast majority of people with migraine, but we hear about this all the time, that someone's got a mother or grandmother with migraines, and the kids got migraines. So it very commonly does run in families.
This next question I think is real important. The question is, what if I struggle identifying some of my triggers? For example, sometimes I don't recognize when I'm stressed. What should I do?
Well, if you're having migraines and you can't put a pin on what exactly, sometimes that happens. Sometimes there are no triggers. Some people just get migraines out of the blue for no good reason whatsoever. And so in that setting, it's good to have treatments. So the kind of breathing therapy that you talked about earlier, and just general mindfulness about how we're taking care of ourselves so that we don't end up stressed. You get your exercise, you eat right, you try to get to sleep at a reasonable hour. You don't stay on the device until midnight with the bright light shining on you. There are a lot of things that you can do to just prevent or prophylax against the migraine. If you can't, just pin it down on it happens because, this or that, red wine or cheese.
It can be really hard to identify these migraine triggers, and sometimes it's something you would least expect. I had a patient struggling with migraines. We finally realized she was eating beef jerky every afternoon to kind of help with that hunger, that afternoon slump, and it had preservatives in it that were triggering a migraine. I mean, sometimes it can be, that's where this keeping the diary, keeping the log, because it can be so empowering to identify and to make those changes, to kind of tune into your own body.
I think that's, you're absolutely right, but I think it's also important to know that not everybody has triggers, right? This is a condition that is a relapsing disorder that sometimes doesn't have triggers. So, you don't want to go on a quest and have a 10-year diary and just, be frustrated all the time. Get the treatment. Yeah. Right. Yeah.
Salad dressings have these hidden preservatives, some potato chips. I understand what you're saying. You will not always identify a trigger, but there are so many, and nutrition is a big, important part of that.
Exactly. Yep, you're right.
Okay, let's move on. Nancy's asking, why do beta blockers work to prevent migraines? Is there another way to get the kind of prevention a beta blocker gives?
Yeah, sure. So in patients who have frequent disabling headaches, doctors can prescribe medications that prevent headaches from coming on. And one of those is a category of medicine that are called beta blockers. And beta blockers are blood pressure medicines. And the way that they work is that they stabilize the blood vessels. Remember, I told you that during a migraine attack, your blood vessels are abnormally reactive and they're dilating and constricting all the time. beta blockers will stabilize those blood vessels so that it doesn't cycle into the migraine and make things worse. There are other blood pressure medicines that work as well. Calcium channel blockers like verapamil. There's a billion blood pressure medicines that have been tested and shown to be helpful in migraine. But it's not just the ones that work on the blood vessels. There are also medications that can be used to change the way that the brain signals to prevent that abnormal signaling. And some medicines like anti-seizure medications can be helpful in prevention. Sometimes low-dose antidepressants can be helpful. Certain ones can be helpful in migraine prevention. There are probably 30 or 40 medicines that can be used to reduce the severity and frequency with which migraines occur. Prevention medicines. And there's some brand new ones that have just come out in the past 2 years that work on a specific migraine mechanism that neurologists and primary care doctors can prescribe. So, but these prevention medicines, we really use them in the cases that where the headaches are really frequent and disabling.
And we will have more information about that in sessions 3 and 4, and then there'll be another webinar where we will talk more about prevention and treatment. So continue to be curious about that, and we will address it further. The next question is, I wear a dental guard for teeth grinding, which triggers my migraines. Is there anything else I can do?
Well, that just sort of gets to the point of some of these other triggers we might not have covered. Teeth grinding can basically make the muscles of the mouth sore, and sitting in front of a computer all the time can make the muscles in your neck sore, and that soreness can feed a pain signal into the brain. And if you're a migrainer, that can trigger the headache. So, you know, I think making sure that you have good orthodontic exam and the dental guards can be helpful. But that is a trigger. You know, in terms of other things that you could do, that's when you talk to your provider and dentist and see if they have other suggestions, if that's not doing the trick.
Yeah, and I think sometimes the teeth grinding is very stress related, and so maybe doing some stress reduction interventions could be a help in that situation as well. Next question is, it seems my migraines are intensifying as I get older. Is there anything I can do to keep them from not being so intense? I know some of my triggers. However, I haven't pinpointed if they're hormonal related. Could they be intensifying due to my hormones changing?
Absolutely. The trend is in women is for headaches to improve as you get older and go through menopause. But unfortunately, the opposite can happen. And so hormonal changes can be contributing to that. But there are other things that can contribute to migraines getting worse as well. And one of those things is when we talk, you're going to learn about treatments in the future, but we talked a little bit about prevention medicines. There's also acute treatment medications. And those are the things that we take over the counter, like aspirin or Tylenol or ibuprofen or Excedrin migraine. Some people use caffeine to stop an acute headache. And what we know is that people who have migraines and who take those acute treatment medicines on more than half of the days of the week or more than half of the days of the month, that can lead to increasing intensity of the migraine, increasing frequency, increasing severity. And so you want to make sure that you're not just driving more headaches by taking a headache pain relief medicine on a daily basis. And that includes caffeine. Caffeine is one of the most common drivers of worsening headaches. And so all the patients that come to me with intractable migraine, I always have them stop caffeine. And I would say half of them get a great improvement from just doing that one thing.
Yeah. I think, you know, different stages of a woman's life in 20s and 30s, when wanting birth control and trying to find the right birth control, realizing that these lower dose orals may be a better option than something like a tricyclic where you have different dosages, and doing some continuous cycling rather than having that placebo week. Then moving into perimenopause and this time where hormones can kind of be all over the place. I know I have seen some neurologists or OBGYNs prescribe a low dose patch to wear, a hormone patch for continuous, just a very low continuous dose of hormone to help for women in that perimenopause phase that are just dealing with chronic migraine. Let's see. Next question is, are there any natural remedies to treat migraines?
Well, so there are a lot of people that claim that certain things, natural things, make their headaches go away, but most of them haven't been tested in the kind of trials that doctors use to determine if something works. And I always tell my patients that if it's inexpensive or if you can afford it and you'd like to try it because like we said, everyone's got different triggers. Some people do respond to different things like herbal remedies and that sort of thing. The only two kind of natural remedies that have been proven to work in clinical trials are magnesium and the vitamin riboflavin. But you have to take so much riboflavin that your urine turns bright orange, and it doesn't work for everyone. But that's one of the things that I try in my patients who want to try to manage their migraines, their chronic migraines, without taking a prescription medication. So and I'm sure this program will give some other natural remedies as well.
Mm-hmm. Magnesium seems like such a simple thing, but it can make such a big difference. Was there a particular brand that you recommend, or?
I don't recommend brands. Yeah.
Okay.
So just try them and see if they work for you.
Yeah, and we can talk a little bit more about some of these in further weeks. Next question, I have noticed that my migraines always come on the last day of my menstrual cycle. Is that normal? My doctor prescribed hormones to take on placebo pill days. Recently I was taken off them because I'm on a different birth control now, but it did help. I think this just highlights how difficult it can be with hormones and finding the right balance, starting the process all over again with the change in meds, which can be frustrating, but I would just encourage you to stay the course, and you will eventually find. You can take 3 or 4 different options before you find the right thing for you. Did you have anything additional about hormonal related things, Dr. Chetkovich?
Like you said, we could have a whole seminar on this.
Really could.
Yeah, but everyone is different. Some people get it on the last day of their cycle. Some people get it in the week before the cycle. Some in the first day, the third day. You hear everyone have a different experience. And it can be difficult, like you said, to figure out what the appropriate treatment is.
This is a little different question. When the pain surrounds an eye, or even feels that it's in the eye, is there any danger to the eye itself? Is there any inherent danger to the brain or other areas?
So the answer to this one is that there's no issue with the eye itself. If we're talking about migraine pain, in terms of inherent danger to the brain, like I had mentioned before, there is an increased risk of stroke in patients who have migraine. And when you've got this very specific type of migraine in which the migraine has manifest with it weakness or numbness or other neurological signs that indicate that the brain is not getting perfusion appropriately, those folks are at high risk of developing a stroke, which would be injury to the brain.
Next question is about allergies. Can allergies trigger migraines? If so, what can be done in addition to taking medicine?
So allergies triggering migraines, absolutely. And just like we talked about the stress in your neck grinding your teeth. When you've got something going on in your nose, sinusitis, that can actually trigger migraine. So it can be difficult to suss out whether something is sinusitis pain or allergy pain, or if it's migraine that's driving it. What we do know is that when we treat the allergies and stop that inflammation inside your head, that can reduce migraines. So we like to make sure that there's no sinusitis, there's no ongoing allergies, because it definitely can trigger migraine. And this is the next question: how does the neck spine affect migraines? Same exact way. If you have stiffness in your neck because you're sitting and staring at a screen all day, that can lead to migraines, and the migraines can cause spasm in the neck. And so it turns out, you'll learn down the road, one of the treatments for recurrent migraines, is to relax the muscles of the face and neck using Botox. So that's an approved therapy for chronic migraine.
Next question, my migraines have increased since getting an IUD. Is this normal?
That is, it depends on if the IUD has a hormone in it. So if it's an old school copper IUD, those aren't associated with change in headache pain. But some of the modern IUDs have progestins in them, which is a female hormone. And that can definitely, if you're sensitive to it, we talked about different people having different sensitivities to hormones, that can definitely be a culprit that could be increasing your migraines. And so if I have a patient that's got a hormone implanted IUD, I will often advise them to talk to their OB-GYN, and if they like the IUD as an option, to switch over to a copper IUD. But my guess is it could be related.
Do you have any advice for dealing with people, especially doctors or employers, who are clearly biased or sexist toward migraineurs? How can we get help if they don't listen?
Well, you find yourself another provider. Ask for a referral to someone else. And if you're talking about an employer, HR, it's discrimination. It's not legal. And I think that how do we get them to listen? It's really hard when people don't have migraines to know how bad these things are. And, it's very, very difficult to communicate that, but it's really terrible. Migraines can be terrible for folks. And I think that, use the tools that you've got to empower yourself. Find a doctor who understands what you're going through and who will treat you appropriately. And, and if it's an employer relation, I'll stay out of that. But I would, if it were me, I would go to HR and say, I need some help here. I've got a medical condition and I'm not being treated fairly.
Good advice. We have a question about magnesium and how much is recommended to start with.
Well, I would, you can find out. I use 200 milligrams 4 times a day, and you can look online. There might be materials that come with this program that have that. But I would talk to your doctor first, because you want to make sure you don't have any kidney problems. It is a supplement, but I would always confer with your doctor to find out how much to use.
And there are some GI symptoms associated with that. So the right formulation, depends on which way you want to go with the GI symptoms. So there's a mag citrate, there's mag oxide.
Yep, and magnesium does cause diarrhea. So almost all medicines have some side effect that limit their usefulness, right?
You start low, yeah.
Start low.
Yeah. This is in a similar vein to another question. Can the misalignment of the bones that make up your spine, especially in your neck, cause migraines?
The answer to that one is that there's no evidence that that's the case. But we do know that people who have neck pain can have worse migraines. And some people use massage, acupuncture, chiropractic treatments, and it helps them. It's another one of those things where we don't have evidence that it works, doctor evidence that it works, but these can be so difficult to treat that I always am open with patients that if you can afford it and you want to try it and it helps you, well then for goodness sake, do it.
Yeah, and I do want to mention we have at the Employee Wellness Center both physical therapy and chiropractic care. And both of our chiropractors, well, 2 out of 3 of our chiropractors do acupuncture as well. So, you know, it's really, it doesn't hurt to try. And using your Employee Wellness Center helps with cost as far as that goes as well.
So, Dr. Shepherd, we're coming toward the end of our time. Do you want to maybe find the best last question? I mean, this has been fantastic. We've had just amazing amount of interesting questions. You want to maybe find the best?
Yeah, the questions are all good. I think if we have time just for one more, let's address this one. Does it mean anything if the migraine hurts in the same spot? For example, always the left temple area.
Well, that's typical for migraines to show up on one side of the head. And in some people, the migraine can be sometimes on the left, sometimes on the right. Other people will say that it's always on the left side of my head. But that's if it's a migraine, and if it's, for example, if it were someone that was 65 years old, they've never had a migraine in their life, they've never had a headache in their life, but they develop head pain on one side of the head, I would want to make sure that I examine that patient and would think about imaging. But if it's a migraine that you've had since you were young or for years and years, that symptom of it always being on one specific side is not uncommon. It's pretty common for migraineurs to say, it always starts behind my right eye, or it always starts behind my left eye.
This has been great. It's really nice to hear and learn from the questions of others, and it's great to have your expertise, Dr. Chetkovich. I know we're short on time, so I'll turn it back over to Phil for the closing comment.
Yeah, thanks a lot. I mean, this has been just a fantastic webinar and lots of great information today. And so, just in closing, let me thank our facilitators and especially you, Dr. Chetkovich, for your valuable time and expertise, and we really appreciate it. The recording for today's session, as well as the resources, will be made available to you within about a week on the benefits website. So you can go back and check that out and get that information. Also, let me encourage you, if you got great value, from our session today, and I think we'd all say, it was fantastic, please tell your colleagues about this session so they can go back and listen to it, and invite them to join us for our second webinar. We're going to do another webinar at the conclusion of the session 3 and 4 videos, and that webinar is scheduled right now for November 12th. Same time, 4:30 to 5:30 Central Time, and you will be getting more information about how to sign up for that closer to the time of the webinar. So, and that's going to cover migraine treatment. So we're going to get into a lot more detail about treatment and then migraine well-being. So let me just say again, just thanks a lot for everyone who's put this webinar together, to our facilitators and Dr. Chetkovich. And, I hope everyone has a great evening, and hopefully we'll see you on our next webinar. So thanks a lot.